For decades, the medical establishment has convinced us that more testing equals better healthcare, especially as we age. But here's what they don't tell you. Some of these so-called essential tests can actually do more harm than good once you reach 70. As someone who's spent years studying geriatric medicine and patient outcomes, I've witnessed firsthand how over-testing can lead to unnecessary procedures, anxiety, and treatments that diminish rather than improve quality of life. Today, I want to share 4 specific tests that you may be able to skip after 70, based on current medical evidence and a more thoughtful approach to senior health care. The truth is, medicine after 70 requires a fundamentally different perspective. Your body has already weathered 7 decades of life, and the aggressive screening mentality that might benefit a 40-year-old can become counterproductive for someone in their 8th decade. This isn't about giving up on your health. It's about being smarter with your healthcare decisions and focusing on what truly matters for your bienestar y calidad de vida. Let me start with the first test that many seniors are receiving unnecessarily: routine colonoscopies. The medical community has drilled into our heads that colonoscopies save lives by detecting colon cancer early. While this is true for younger populations, the equation changes dramatically after 70. Current guidelines suggest that if you've had regular screenings with normal results throughout your 60s, the benefit of continuing colonoscopies after 75 becomes questionable, and after 80, most medical organizations recommend against them entirely. Here's why this matters. A colonoscopía no es un procedimiento simple, sin riesgo. It requires bowel preparation that can cause dangerous dehydration in older adults, especially those taking blood pressure medications or diuretics. The procedure itself carries risks of perforation, bleeding, and cardiovascular complications that increase with age. More importantly, any polyps or early-stage cancers found would grow slowly enough that they're unlikely to impact your life expectancy significantly. When you consider that the average person diagnosed with early-stage colon cancer at 75 has a better chance of dying from heart disease, stroke, or another condition entirely, the aggressive pursuit of potential colon cancer becomes less compelling. The preparation alone can be dangerous for seniors. The powerful laxatives used can cause severe electrolyte imbalances, particularly problematic if you have kidney disease, heart problems, or take multiple medications. I've seen patients end up in the emergency room from dehydration and electrolyte disturbances caused by colonoscopy prep, facing complications far more immediate and serious than any potential cancer that might have been found. The second test to reconsider is routine mammography screening after 75. This recommendation might surprise many women who've been told that breast cancer risk increases with age. While it's true that breast cancer incidence rises with age, the benefit-to-harm ratio of mammography screening shifts significantly in your mid-70s. The American Geriatric Society suggests that women with a life expectancy of less than 10 years may not benefit from continued mammographic screening. Mammography becomes problematic for several reasons as we age. First, the rate of false positives increases, leading to unnecessary anxiety, additional imaging, and biopsies. The stress of a potential cancer diagnosis, even when it turns out to be benign, can have profound effects on mental health and overall well-being. Segundo, la mamografía puede detectar cánceres que crecen lentamente que nunca habrían causado síntomas o afectado la esperanza de vida. This phenomenon, called overdiagnosis, leads to treatments including surgery, radiation, and chemotherapy that can significantly impact quality of life without providing survival benefits. Consider the mathematics involved. If mammography prevents 1 death from breast cancer for every 1,000 women screened over 10 years, but you're 78 years old with diabetes and heart disease, are you likely to live long enough to experience that benefit? Meanwhile, the false alarms, additional procedures, and anxiety from screening are immediate and certain. Many oncologists are beginning to have frank conversations with their older patients about whether the potential benefits justify the definite risks and discomfort of continued screening. The third test that deserves scrutiny is routine PSA screening for prostate cancer in men over 75. The prostate-specific antigen test has been controversial for years, but the controversy becomes even more pronounced in older men. Most prostate cancers grow extremely slowly, and autopsy studies show that many men who die of other causes have prostate cancer that never cause symptoms. The likelihood that a prostate cancer detected at 75 or 80 will significantly impact life expectancy is relatively low. PSA screening leads to a cascade of interventions that often cause more problems than they solve. An elevated PSA typically leads to a biopsy, which carries risks of infection, bleeding, and pain. If cancer is found, the pressure to treat becomes enormous, even when the cancer might never have caused problems. Prostate cancer treatments, including surgery and radiation, commonly cause incontinence and sexual dysfunction, complications that can devastate quality of life for whatever years remain. The irony is that the anxiety and stress from an abnormal PSA test, followed by the complications of unnecessary treatment, can actually shorten life more than the cancer would have. I've counseled many families where an 80-year-old man went from being active and independent to requiring diapers and dealing with depression after aggressive prostate cancer treatment for a cancer that likely would never have harmed him. The fourth test to question is routine bone density screening in very elderly patients, particularly those over 85. While osteoporosis is a legitimate concern for seniors, the usefulness of DEXA scans decreases significantly in the very elderly. By the time you reach 85, nearly everyone has some degree of bone loss, and the scan results rarely change management in meaningful ways. More importantly, the medications typically prescribed for osteoporosis, particularly bisphosphonates, come with significant risks that may outweigh benefits in the very elderly. These medications can cause unusual fractures, jaw problems, and esophageal issues. They also require patients to remain upright for 30 minutes after taking them and avoid eating, which can be challenging for seniors with mobility issues or cognitive impairment. The focus for very elderly patients should shift from trying to improve bone density to preventing falls, which cause the vast majority of fractures in this age group. Simple intervenciones como quitar alfombras de tirón, mejorar la iluminación, revisar medicamentos que causan mareo, y mantener la fuerza muscular through appropriate exercise provide far more benefit than knowing your exact bone density numbers. What's particularly concerning about these screening tests is how they can trigger what medical professionals call the cascade effect. One abnormal test leads to another test, which leads to a procedure, which leads to a complication, which leads to hospitalization, which leads to functional decline. I've seen this pattern countless times. A healthy 75-year-old goes for routine screening, gets an abnormal result, undergoes additional testing and treatment, and ends up significantly worse off than when they started. The financial implications are also worth considering. Medicare covers these screening tests, but the downstream costs of false positives, unnecessary procedures, and complications can be enormous, both financially and personally. More importantly, the time and energy spent pursuing marginally beneficial screening could be better invested in interventions that actually improve quality of life, staying physically active, maintaining social connections, managing chronic conditions optimally, and focusing on functional independence. This doesn't mean abandoning medical care after 70. It means being more strategic and thoughtful about it. The goal shifts from detecting every possible problem to maintaining function, independence, and quality of life. Síntomas deben seguir evaluándose. El cuidado preventivo para condiciones como enfermedad cardíaca y diabetes sigue siendo importante. y mantener relaciones with healthcare providers is crucial. But the automatic assumption that more testing equals better care needs to be questioned. The conversation about appropriate screening should be individualized and should include discussions about life expectancy, overall health status, and personal values. A healthy, active 75-year-old with no major medical problems might reasonably continue some screening that wouldn't make sense for an 82-year-old with multiple chronic conditions and limited mobility. The key is having honest conversations about goals of care rather than simply following one-size-fits-all screening guidelines. Healthcare providers are beginning to recognize this shift. Progressive medical centers are implementing Choosing Wisely campaigns that encourage both doctors and patients to question whether certain tests and procedures truly add value. The American Geriatric Society has published extensive guidelines about appropriate screening in older adults, acknowledging that the aggressive approach suitable for younger patients often becomes counterproductive as we age. What should you do with this information? Start having different conversations with your healthcare providers. Ask questions like, what will we do differently if this test is abnormal? How will the results change my care? ¿Cuáles son los riesgos de la prueba misma? Given my overall health and life expectancy, is this screening likely to help me? These questions can help you and your doctor make more thoughtful decisions about which tests truly serve your best interests. Consider also the concept of medical burden. Every test, every appointment, every procedure takes time and energy. As we age, these resources become more precious. Spending a morning getting a marginally useful screening test might mean missing time with grandchildren, skipping a social activity that brings joy, or simplemente sintiéndose exhausto para el resto del día. When the likelihood of benefit is low, these opportunity costs become significant. Remember that good medical care after 70 focuses on different priorities than medical care at 50. The emphasis should be on maintaining function, previniendo la discapacidad, gestionando los síntomas de las condiciones crónicas, y preservando la independencia y la calidad de vida. Screening tests that don't clearly contribute to these goals deserve skeptical evaluation. The medical system has been slow to adapt to these realities, partly because it's easier to apply standard protocols than to individualize care, and partly because our culture equates medical activity with medical quality. But evidence-based medicine increasingly supports a more nuanced approach to screening in older adults, one that considers the whole person rather than just the potential disease. This shift requires courage from both patients and providers. It's challenging to step away from tests we've been told are essential, and it requires healthcare providers to have more complex, nuanced conversations rather than simply ordering routine tests. But the result can be healthcare that's more aligned with your actual needs and more likely to support the kind of aging you want to experience. The bottom line is this: after 70, medical care should become more thoughtful, not more routine. Every test should earn its place in your care plan by demonstrating clear potential to improve your health, function, or quality of life. The 4 tests I've discussed today often fail this standard, and understanding why can help you make better healthcare decisions as you navigate your 70s, 80s, and beyond. Your healthcare should serve your life, not the other way around, and sometimes that means having the wisdom to do less rather than more.